Hello, everyone, and welcome to today's Technical Assistance Marketplace Vendor Fair. Today, we'll be focusing on Domain 1, which is the building data capacity, including the data collection, management, sharing, and use. We can go to the next slide. Letting you know who we have today on the call. There's myself, Michael Weezar. I am a branch chief here at Department of Healthcare Services, working with the PATH team. Also joining is Shell Wong, the section chief over the project coordination section, and also Jasmine Garcia, who is our unit chief over the PATH unit. From Public Consulting Group, we have leads including Trish, Eliza, and Danielle, who will be supporting the logistics of the call today. We can go to the next slide. So we're really excited to have this vendor fair today. We've made a lot of exciting improvements to the technical assistance marketplace for usability and overall experience. But today we'll be having an orientation to the vendor fairs, as well as showcasing many vendors and the services and projects that they offer. We'll be providing some resources and updates as it relates to the marketplace, and finally opening for question and answer. Next slide. And really level setting the purpose, these vendor fairs, we've had several, but the vendor fairs are an opportunity for the vendors to share information about their organization and services to potential recipients and support utilization of the marketplace overall. And we've had, as I said, several vendor fairs already, and will be continue to do so through April, which is just around the corner, across the 7 different domains offered on the TA marketplace. So with that, I'm going to hand it over to Eliza, and I hope everyone has a wonderful experience.
Thank you, Michael. We can go to the next slide, please. All right, I'm going to give a brief overview of this domain. So domain 1, building data capacity. Some examples of the potential TA in this domain include strategic and tactical support for data collection, exchange, management, and use, workflow redesign, guidance related to implementing EHR and care management documentation systems across Medi-Cal managed care plans, best practices and technical assistance related to billing and coding, technical assistance related to implementing and modifying data systems, legal support for developing and reviewing data use agreements, leveraging data analytic platforms and analysis to support population health management, use of DHCS specified standards for sharing information, and support for the design and implementation of analytics. Domain 1 vendors have the expertise to support TA recipients to build knowledge and implement the systems required to effectively leverage data in their work with and on behalf of Medi-Cal members receiving ECM and community supports. We can go to the next slide, please. This is a very high-level agenda. So we're currently in the welcome and introduction phase. We'll transition to the vendor pitches shortly, which will be about half an hour, 40 to 35 minutes. And then we will transition to the breakout room sessions, which will be another half an hour for robust discussion and question and answer between recipients and vendors. And then we'll close with a Q&A and some updates and closing remarks. We can go to the next slide, please. So just some quick Zoom logistics. Please make sure you have the Zoom app downloaded on your device and you have logged in using the Zoom app to ensure successful participation in the breakout rooms later in this event. If you have joined by phone or browser, please rejoin using the app at this time. And you can use this link right here on the slide to do so. Please use the Q&A functionality to ask any general inquiries regarding the TA marketplace or any technical issues. And do note that please save your vendor-specific questions for the breakout rooms. The next half an hour is really saved for vendors to present themselves to you, so we'll have plenty of time to ask them questions during the breakout room sessions. Next slide, please. All right, quick overview of the vendor pitches. Next slide, please. So vendors will be presenting in alphabetical order. They will have 1 minute each to present their organization. I do have a timer set up on my phone, so if you start to go over that 1 minute mark, I will interrupt you just to make sure everyone has time to present. And vendor-specific questions will not be answered during this time. Please save those great questions for the breakout room sessions. Next slide, please. All right, Apt, you are up.
Thanks. Good morning. It's great to be with you all today. My name is Clint Eisenhower from App Global, which is a consulting firm with a 60-year history focusing on improving the quality of life and economic well-being of people worldwide. Just a little bit about me. I spent 18 years in government as a former state government employee in Pennsylvania, working for the Department of Human Services, which is also the state Medicaid agency. And I also worked at the Centers for Medicare and Medicaid Services, or CMS. I'd like to share a little bit about apps. We provided TA support in 25 states, including California. We have large contracts with federal agencies such as CMS, CDC, and HUD. We've developed a similar TA program in Massachusetts to help community-based organizations. And we generally have a highly flexible and responsive approach to designing and implementing training in TA. So in Domain 1, we can support organizations around data capacity, including strategic and tactical support for data collection, exchange management, workflow redesign, modifying data systems, and leveraging analytics. So I look forward to seeing you all in breakout room 1, and I appreciate your time, and I'll turn it back to Eliza. Thanks.
Thank you so much. Next up, we have Altarum. We can go to the next slide, and on deck is BluePath.
Hi, good morning. I'm Maggie Fairchild, and I support business development with Altarum. We're a nonprofit organization, and we're focused solely on health. So we partner with federal agencies, state agencies, and county governments, managed care plans, community-based organizations, and providers. And our team has particular depth of expertise around Medicaid, including LTSS and dual eligible programs, and significant experience providing TA to providers. Our TA programs have supported nearly every state since our existence of over 70 years, including California, where we've helped provide TA to CDPH for the newborn screening program, really looking at how to improve timeliness of data sharing. And we're currently working with Orange County to build the first multi-drug resistant organisms registry in the country, really focused on data sharing and increasing interoperability to support care coordination. Under Domain 1, we can provide hands-on TA services, supporting providers and organizations around data collection, management, and modernization, EHR support, and designing and implementing systems. Our TA model has been honed over 20 years of providing this support across the country. For example, we've supported similar Medicaid transformation initiatives under CMS, including support to over 10,000 rural providers and practices. And you can find us in breakout room 1. Thank you.
Thank you, Altarum. Up next is BluePath. We can go to the next slide, and on deck is Camden Coalition.
Thanks, Eliza. Hi, I'm Libby Sagara. I'm Managing Director at BluePath Health. We provide services to clinics and health systems, CBOs, county agencies, including justice, youth organizations, medical managed care plans, and technology providers. We're based in Northern California, and we have staff in the Central Valley, Los Angeles, and San Diego. We're also facilitators of CalAIM Path collaboratives in Alameda, Santa Barbara, San Luis Obispo, and Ventura counties. And we have over 20 years of experience working with stakeholders to foster the sharing of health and social services data to improve member access, quality, and equity. We offer CalAIM participants expertise in strategy, policy, program planning, technology implementation, reimbursement, UI, and data sharing. Under Domain 1, our TA Marketplace projects can involve technology needs and gap assessments, systems evaluation, procurement, project management, and implementation support, use case development, testing for data sharing, EHR, case management, referral and billing optimization, population health, and analytics. And we look forward to answering your questions in breakout room 3.
Thank you so much. Up next, we have Camden Coalition, and on deck is Chorus Innovations.
Good morning. My name is Jim Hickman. I'm the California lead for the Camden Coalition's CalAIM work. We're excited to be joining all our fellow participants in this call. We're a 20-year-old nationally recognized organization, really building the field of complex care. I've been involved with them for their deep body of work in California for the past 10 years. Where we do something different, we actually run an HIE in Camden, New Jersey, and from those lessons build out care models with a specific focus on building community-based care collaboration, or as we will call it today, whole person care. So our approach to data capacity building really starts from your context. So we define data in terms of your context as a provider and whatever role you play. We work with you to understand your sources and uses of data, and then we match your data against the policy, the program design, and workflows that are going to lead to shortening the distance between people and their needs getting met. So again, we look forward to partnering with all of our participants in this call and with all of you in the community. We are a CPI stakeholder engagement lead, like many of our other friends on this call, and hope you all consider coming to our conference later this year. Thanks.
Thank you. Up next, we have Chorus Innovations, and on deck is Cope Health, Consilience Group.
Hi, everyone. I'm Ryan Napier. I lead strategic partnerships and business development for Chorus Innovations. We are a digital health technology company centered around the idea that health is always local and each system of care is unique. But while each county or region system of care is unique, core problems are not. Disjointed, disconnected technologies make collection, tracking, sharing of information across service lines, whether internally or externally, very difficult. So people are still using phones and spreadsheets and whiteboards, even paper, to track clients across the system. And we know enhanced care management providers feel this pain most acutely. We are not an EHR system. Instead, we work between them, and we work with our state, county, and provider clients to leverage our library of digital templates that can be tailored to create custom infrastructure and specialized workflow tools that unify these disjointed systems and drive seamless, efficient care coordination. The diagram on our slide represents how these templates integrate and work together to drive this seamless care coordination that is so necessary to effective enhanced care management. I'd love to share more about what we bring to the table as a partner, including our collection of highly specialized community engagement officers that we have on our team. And I hope to see you in breakout room 3.
Thank you so much. Next up, we have Consilience Group, and on deck is Cope Health Solutions.
Hello, everyone. My name is Janessa Spears. I'm a portfolio manager and anthropologist at Consilience Group. I am based in Memphis, Tennessee, but I'm originally from rural southeastern Nebraska, and I've been with Consilience Group for 8 years. Several of my colleagues, including myself, are certified in what's called results-based accountability, or RBA, a simple framework for establishing performance measures and the transparency and accountability needed for a data-informed culture. So I would call myself a data convert. Some people are data people naturally, but that's not the case for me. And our work really centers around setting a collective vision and developing the supportive infrastructure to sustain it. So Consilience Group works across many of the domains, but mine is really focused on partnering with organizations to redesign their systems and implement a culture of learning. I'd love to tell you more.
Thank you so much. Next up, we have Cope Health Solutions, and on deck is Dawn Chorus Group.
Good morning, everyone. Evan King with Cope Health Solutions. I'm a principal. My favorite domain, data. So excited to meet with you all in our breakout room 6 shortly. One of the things I think is most important about this domain is helping organizations at whatever level of maturity they are at being comfortable with data, how to utilize it, how to make it easy to access, and really drive the results that you want. I think as we continue to move through CalAIM, being able to demonstrate results around quality and outcomes will be key to developing value props for your managed care plan partners and your provider organizations. We have deep experience in running analytics with managed care plans across the state, utilizing claims data, generating claims and bills, and likewise helping to develop the workflows required for stratification and redesign to use those tools in your organization. Looking forward to seeing you all in Group 6. Thank you.
Thank you so much. All right, up next we have Dawn Chorus Group, and on deck will be Demaji.
Hello, everyone. I'm Mel Cronin, the Chief of Staff at Dawn Chorus Group. Dawn Chorus Group is a research and evaluation focused business. We have strong backgrounds in public health, psychology, sociology, technology, and geography, excuse me. We used advanced data science and AI techniques, and we really do tailored data management, data collection, and data reporting for your organization. So we really are relationship driven, and we depend on you to help us guide the services that you need. We are very focused on health equity and advancing justice through robust research and innovative technology. I look forward to talking to you all in our breakout groups.
Thank you so much. Up next, we have Dimaji, and on deck will be Evaset.
Hi all, I'm Lily Olson with Dimagi. Many of these organizations support really robust data management. Our organization supports really robust data collection and case management and care coordination. So our marquee product, ComCare, is a low-code application builder that allows us to rapidly configure case management and care coordination solutions that are tailored to your workflows and your data collection needs. We can support you to implement ComCare, integrate ComCare with your existing technical suite, and create reports and data visualizations using your ComCare and other data sets. We are unique in that we are a certified benefit corporation. So we offer you a true partner experience, and we share your goal to serve traditionally underserved members of our community. Thank you.
Thank you, Dimagi. Next up, we have Evaset. Oh, excuse me. Next up, we have Evaset, and on deck is Goldfinger Health.
Good morning, everyone. I'm Julie Lawrence, CEO of Evaset, and we hope that you will connect using our QR code on the slide or come to breakout room 4 so we can get to know you better. Evaset is a motivated CalAIM TA provider. We've been here since the start of the marketplace with over 20 projects covering more than 20 counties. We are Stanford University trained in value-based care, hardworking, and easy to collaborate with. So I want to just highlight 2 things that we've been hearing in the realm of building data capacity that ECM and CS providers need. The first is proving the value of your services with data. And we focus on data that is easy for you to capture and helps you demonstrate your organization's value to MCPs and show them the health outcomes that you are helping to achieve with your own data. We can support you with design and implementation of analytics, benchmarking, and a method for proving your impact that describes what you're doing in ECM and CS. The second thing that we've been hearing is that providers really need help still charting the path out of data overwhelm. We've worked on lots of big data projects in healthcare and social care and know that the tendency is to collect everything at once, but not always know exactly what you're going to do with it, which can be both inefficient and overwhelming. So we help you cut through that to the most important data to collect and manage first, second, and later. And then how to align your workflows and processes so that you can focus on taking care of California's high needs community members, which is such an important thing. Thank you.
All right. Thanks so much, Evaset. All right, up next we have Goldfinger, and on deck we have Greg Factor.
Thank you, and good morning, everyone. I know this is a lot, so bear with us. I'm John. I'm the founder and CEO of Just Whole Care. And I'd say we're different in the sense that we don't just look at the data needs you have from the point of care or service delivery or even just payment, which we do. We also look at it in terms of the systems changes you need. And here's why. After first responders saved my father and many others on 9/11, I was blessed to help the CDC design data tools for monitoring the health and well-being of these heroes where there really were none. Similarly, for the World Health Organization in Honduras, abroad, and many departments of public health at home. These kind of led me on this nerdy journey, right, to advance how we measure things like the care of mothers, children, TAE, and adults with specialty mental health needs, substance use needs, including across life's transitions, holding our payers accountable, and giving every population equitable access to not only the data, but the technology, quality technology that can get us there. Just Whole Care loves working on theories of change that can help you bridge your ECM, community supports, and other services you offer, as well as providing core metrics for even those stuck in the mud colleagues to align and help you all move to pay for outcomes. Together, we can drive change, making data useful. I'd love to help. Join me in break room 5.
Thank you so much, Goldfinger Health. Next up, we have Greg Factor, and on deck is Health Management Associates.
Hey, good morning, everyone. My name is Mike Wong, Director of Business Intelligence at Factor. Formerly named GFA, Factor is a healthcare consulting company that has supported health centers in California since 2001. To date, Factor has provided ECM support to over 20 different organizations with hands-on custom-tailored projects. Factor's 100% project approval rate in the TA marketplace, and we provide free application support as well in the marketplace. In Domain 1, Factor's past projects include building automated RTF and OTF reports to support reporting accuracy and saving staff time, service and payment reconciliation ledgers to ensure proper reimbursement, and automated ECM dashboards to support oversight of the ECM program, managing the ECM program by individual staff, and daily workflows by assigning staff with patient lists stratified by risk and gaps in care. But we also support organizations across 3 other ECM domains. Thank you, and we look forward to speaking with you in breakout room 6.
Thank you, Factor. Up next, we have Health Management Associates, and on deck is Health Roads. And Health Management Associates, you are on mute if you are speaking.
Good morning. Good morning, everyone. I'm Eileen Muscartolo, and I work out of the Greater LA offices at HMA. We're a nationwide firm that was founded in 1985. We've supported TA Marketplace in several states across the nation. We're one of the few TA Marketplace vendors that are in all domains. We've been on the Medi-Cal journey with CalAIM back to whole person care. We've supported the managed care plan stand up CalAIM, so we have deep understanding of the processes of the managed care and their technology needs and what they're expecting. We support all facets of the CalAIM vendors. We work with small CBOs, we work with the counties, so we really have a deep understanding of the needs, especially the small CBOs. We're fluent in the ECM and CS policy guides, and we would look forward to working with you in breakout room number 7.
Thank you so much, Health Management Associates. Up next, we have Health Roads, and on deck is Infoline of San Diego, or 211 San Diego.
Good morning, everybody. My name is Rajeev Ghosh. I'm the CEO and founder of Health Roads. We are a boutique consulting firm based in Newark, California, and we offer multiple different services for the Medicaid and managed care solutions for social care CBOs. We also advise and implement services for SHIE CIEs and EHR implementation services, as well as social care system implementation services. For the TA Marketplace services, we actually work with our CBOs, community hubs like communities of health, accountable communities of health who are participating in CalAIM, ECM, and CS services for the reimbursement program. So we actually build data systems that can actually help you, with your entire billing and reconciliation process. We are working with multiple such organizations from needs discovery to solution implementation. So Health Roads has hands-on experience in enabling non-medical CBOs and community hubs realize new revenue streams. We are working in California in this CalAIM world since early 2022, and multiple millions have been transacted over our systems that we have built already. And we are looking forward to meet with you in breakout room 2, and we'll be happy to share more of our experiences there. Thank you.
Thank you, Health Roads. Up next, we have 211 San Diego, and on deck is Innovation Horizons.
Hi, everyone. I'm Shelley Parks with 211 San Diego, which is probably best known for building, implementing, and scaling the first ever Community Information Exchange, or CIE, in the nation. And a CIE effectively facilitates community care planning. We've been awarded $3.3 million in cited and IPP funding locally here to enhance our infrastructure and streamline the implementation of CalAIM in San Diego County, leveraging our CIE as a coordination tool. We have technical expertise as a direct service provider for both ECM and housing navigation. We're leading collaboration efforts of shared learning through a statewide community of practice, and have built local infrastructure to help members and providers navigate the maze of these incredible CalAIM services. Please scan the QR code on our slide to view our website highlighting the local infrastructure in San Diego we've created to coordinate CalAIM resources. Our team's ready to help your community build upon existing infrastructure and assets to streamline services for those who should have easy access to CalAIM services. If we sound like the right TA provider for you, come meet us in breakout room 4 to engage in some conversation about building data capacity in your community.
Thank you so much, 211 San Diego. Up next, we have Innovation Horizons, and on deck is Intrepid Ascent.
Thank you. Hello, my name is Lucas Chamantosi. I'm Senior Vice President at Innovation Horizons. We specialize in integrating highly innovative health technologies and services into sustainable business practices. Our focus is on supporting organizations to be successful in whole person healthcare system delivery. Our team of experts offers a broad range of off-the-shelf and hands-on technical assistance in the CalAIM marketplace. At Innovation Horizons, we blend clinical expertise with policy insights and technical acumen to provide smart solutions for your complex healthcare challenges. Join us in room 3 to learn about how we assist your organization, or how we can assist your organization with your data and analysis needs, whether it be technology assessments, roadmap building and implementation, or developing dashboards and reports, perhaps performing deep dives into your billing and coding data, or ultimately helping you to use your data to communicate and collaborate with your local communities to tell the story of how your organization is making positive and significant impact within the CalAIM ecosystem. Our team looks forward to meeting with you in room 3. Thank you.
Thank you, Innovation Horizons. Up next, we have Intrepid Ascent, and on deck is Primary Care Development Corporation.
Hello, good morning. I am Alexandra Milliton with Intrepid Ascent. We are a strategic consulting partner for community health transformation based in Berkeley, California. At Intrepid, we help community partners optimize their unique services while evolving together towards improved community health outcomes. Our work promotes the adoption of scalable technologies with a person-centered approach focused on both individual experience and collective impact. We support our clients in clarifying strategic intentions for data use, assessing technology needs, and implementing adaptable solutions. Our TA services cover the spectrum of technology adoption needs, from assessing and creating implementation plans, establishing frameworks for community and data governance, procuring and implementing solutions, and designing workflows to enable cross-sector care coordination, analytics, and data exchange. Whenever possible, we promote the use of shared local infrastructure that delivers value across multiple programs and initiatives. Organizations that may benefit from our technical assistance include CBOs who are contracted with the health plan for the first time, ECM or community supports providers navigating CalAIM requirements, and organizations looking to improve their compliance posture and/or technology infrastructure. If you're interested in learning more about how we can work together, I encourage you to join us in breakout room number 8.
Thank you so much, Intrepid Ascent. Up next, we have Primary Care Development Corporation, and on deck is Provisio Partners.
Hi, everyone. I went over time a little bit, so I'm going to try to keep this short and be respectful of everybody's time. My name is Christina. I work for Primary Care Development Corporation. We're a 30-year-old nonprofit that exists to expand access and equity within the primary care space. I run the West Coast portfolio for Primary Care Development Corporation. I'll just talk a little bit about some of the work that we've done within the CalAIM landscape to date, which has been significant, but it really has focused on a few key areas, mostly on evaluating whether or not enhanced care management is a program that really makes sense for an organization, both from a data and operational perspective and a financial perspective. And then we do a significant amount of work around quality improvement. So as I'm sure many of you know, CalAIM has really forced an up-leveling or a greater sophistication around data understanding and data use. We're currently working with LA County Department of Health Services to restructure the quality improvement strategy and infrastructure around for Housing for Health and the Office of Diversion and Reentry. We also work with very tiny privately owned providers to figure out a way that CalAIM could potentially work for them. So happy to answer more questions in the breakout session. I'm in breakout room 5.
Thank you so much, Primary Care Development Corporation. Up next, we have Provisio Partners, and on deck, we have Sage Surfer. And Provisio, if you're
Thank you, Eliza. Sorry, I had a hard time getting off mute. Good morning. My name is Erica Cox, the Managing Partner and Chief Innovation Officer at Provisio Partners. Provisio is a consulting firm solely focused on providing technology solutions for health and human services organizations. Our clients support their communities in all subverticals of human services in both the nonprofit and public sectors. Relevant to the TA marketplace in CalAIM, we have completed or are currently engaged with 9 providers to improve efficiencies for their ECM programs. These providers vary greatly in size and leverage our Salesforce-based solution in varying ways. Some use the solution for outreach only, supplementing an existing EHR via integration, while for others it supports the full ECM lifecycle. Features include MIF ingestion, instant identification of new members for outreach, tracking and management of outreach attempts, RTF/OTF generation, care plan creation, referral management, and encounter tracking, all across a multitude of MCOs within California. 7 of these organizations are also using this solution to fully support their CS housing navigation needs, from referral through assessment, case management, and encounter management. All data collected can be easily visualized via reports and dashboards accessible to all users. Please connect with us using our QR code or join us in breakout room 6 to learn more about how we can help your organization manage your CalAIM programs more efficiently.
Thank you so much, Provisio. Up next, we have Sage Surfer, and on deck is Serving Communities Health Information Organization.
Hi, this is Anupam. I'm a co-founder and CEO of Sage Surfer. So we are a healthcare digital health technology firm. Together with consulting, we've been working in Medicaid and Medicare for multiple years, both at the administrative level, building technologies at a consulting, MCOs and CBOs, ECM, and multiple different organizations. We take a very different approach. We had been from our living experience perspective, how to deliver whole person, whole family care. And that's what we have tried to bring it both from the consulting side as well as this. All our members have a living experiences. Or from a TA market perspective, we not only allow to understand what the data nuances are there, but also understand exactly how to best use it, how to integrate it, how to bring health equity into picture, how to make sure living experiences, and how to make it more sustaining as well. Why we are different or why we are unique perspective is more about our experiences working with various different organizations before the ECM as well, with marginalized population at the tiny organization to the large organization, personalizing the care plan, fostering the care coordination, and making sure the programs are more sustainable and able to bring those deep expertise in to make it more scalable, more interoperable, and more successful in the long run. Meet us at breakout number 2. Looking forward to chatting with you to help you out and for your KLAM needs.
Thank you, Sage Surfer. Up next, we have Serving Communities Health Information Organization. And on deck, we have Shari Brenner, Healthcare Consulting.
Thank you, Eliza. Good morning. I'm Dan Chavez. I'm Executive Director of Serving Communities Health Information Organization, or SCIO, located in Santa Cruz, California. SCIO is one of the oldest HIEs in the country and the oldest HIE in California. We're also a qualified HIO, the Data Exchange Framework Paradigm and Framework. As such, we are a data company. We are expert at aggregating data, curating data, sharing data, and controlling the access of data to those who need to see it. As such, we're tremendously focused on the individual and getting that individual whole person care. Secondarily, we provide the right data to caregivers. Caregivers are a tremendous focus of ours and the communities where both live. So we're very anxious to support your data requirements, whether it be at the entire community level or a thin slice, whether it be a practice, a patient cohort, a DC state, or the like. Thanks very much for your time and consideration.
Thank you, SCIO. Definitely using that acronym. Up next, we have Shari Brenner, Healthcare Consulting, and on deck, we have Social Finance, Inc.
Wow, what an honor to be part of this group of skilled individuals and agencies. As an independent consultant, I'm here doing this work because I think the vision of CalAIM is brilliant. Client-centered services that really make a difference in people's lives, and health is what brings me here, and clearly you're all here for the same reason. Yes, brilliant, but data is one example of its messiness. I confess to being a little bit heartbroken that the state didn't implement a reporting platform for everybody to use. Of course, we all understand why that couldn't work. I, for one, would probably not sign that consent form. So we are all creating similar wheels, hopefully intelligently and as collaboratively as possible. I'm a data geek, and it's because I love data done right. Meaningful data for decision-making purposes, good systems for referrals and community collaboration, and easy reporting to health plans in the state. Documented, well-designed workflows for your staff, new and seasoned, to use as training and reference material is essential to just make the work work. I want to be part of making the CalAIM vision come true, and I would love to help you with data so you can focus on taking care of your clients and patients. And thank you for doing that. I will be in breakout room 7 and would love to meet with you. Thank you.
Thank you, Sherry Brenner, Health Systems Consulting. Up next, we have Social Finance, Inc., and on deck, we have Thurmond Consulting.
Hi, thank you so much. Thanks for the chance to say a few words here today. So first, just really briefly, I came to Social Finance. We're a nonprofit. We have a footprint nationally. After a stint as the chief of staff at the Rhode Island agency that manages the mental health system, developmental disability system, and the state hospital system. And I was sort of the data guy there. And I learned something that, data itself can't really do much for you unless it's connected to outcomes. And that's really why I found a home at Social Finance. We're really focused on building data-driven tools to help advance outcomes, the outcomes that governments, providers, community-based organizations really want to drive through their programs. Because ultimately, that's our mission, is making these programs better for the people who use them. So thank you very much. Excited to tell you more in breakout room 2.
Thank you, Social Finance. Up next, we have Thurmond Consulting, and on deck is our last vendor, Unite Us.
Thank you so much. Good morning, everyone. My name is Isaiah Rich Wimmer with Thurmond Consulting. Thurmond Consulting is a firm based out of Sacramento, California, and we provide a myriad of services, primarily with homeless services and housing agencies. And so part of what our focus is we work with a number of small organizations across the state that have been looking at getting into either ECM or CS services. And the primary thing that we hear with a lot of the organizations we work with is the how and why. How do we get into the system, and why do we want to? What's the benefit, or how will this help us with our services or what we're looking to do? And we really try to provide that and help that assessment with you to figure out the how and the why. And specifically when it comes to data and reporting, we try to provide an assessment that helps you understand why these components are important and help create pathways for you. So if you are an organization that's new to the system, or you're trying to learn more or add depth to your organization with some of these services, please come and talk with us. We'll be in breakout room 5. Thank you so much.
Thank you, Thurmond Consulting. And up next, last but not least, Unite Us.
Good morning, everyone. Thanks for the time. Thanks for all the vendors who have already presented. My name is Graham Charlton. I'm the Director of Network Development across California. I live just outside of Los Angeles, and I work with CalAIM stakeholders and prospective stakeholders across the state. So Unite Us is as a veteran-founded organization. Back in 2013, we cover about 90% of California's 58 counties, and we're active in about 46 states in the United States. In addition to California, we also support other 11-15 expansion states like North Carolina, New York, Oregon. And essentially, we provide an accountable network and intuitive technology to enable secure care coordination via a closed-loop referral system. Meaning that we connect government, healthcare, and community providers in a secure and largely automated process, while also generating outcomes data to drive performance improvement and reduce barriers to access. Specifically within CalAIM, we are supporting a variety of different stakeholders and organization types like managed care plans, government entities, healthcare and community-based organizations to identify and document social needs via SDOH or things like ECM screenings, referring clients to contracted partners, and closing the loop without the manual processes that largely legacy referral pathways require. We enable network partners to provide trauma-informed care with a longitudinal social care client record. We help to monitor social care capacity and target investments where they're needed most. We also analyze outcomes data and provide that outcomes data in real time to help you better understand how you're serving and who you're serving, and where there may be opportunities to grow. And last but not least, we help to generate community supports and ECM billing and reimbursement documentation via invoices or claims So if I can be a resource, please let me know. And I'm actually going to be in breakout room 8. Thank you.
Thank you so much, Unite Us. We can move to the next slide. Vendors, thank you all so much for really sticking to that 1-minute timeline. I know it's super hard to fit everything in that you want to say. So just thank you so much for being respectful of each other's time and our agenda. We can go to the next slide, please. We're about to transition into those breakout rooms. They are an opportunity for attendees to ask questions of these vendors, the ones that just gave you these fabulous pitches and all that information. If you want to learn more, definitely go check out their breakout room, hear more details about their projects and services. We do request that you all raise your hand and use the raise hand button at the bottom of your screen. Please mute yourself as well. These are an interactive room, and members of our staff will call on you to ask your question of the TA vendors. We ask all attendees again to remain muted until they have been called on, and then go ahead and remute yourself after you've asked your question. Messages will be sent out to all breakout rooms at the 5 and 1 minute mark, as well as when breakout rooms will move into the main room. And once again, please be sure that you have the Zoom app downloaded onto your device to ensure successful participation in these breakout rooms. If you have joined by phone or browser, please rejoin via the Zoom app at this time. Otherwise, you will not be able to participate. Next slide, please. So moving between breakout rooms, you will be automatically and randomly assigned to a breakout room. And if you would like to change rooms, you'll be able to move between them. Please select join when the breakout rooms are opened and a pop-up appears. To move between breakout rooms, identify the breakout room number that you would like to move to. Click breakout rooms at the bottom of your screen on the Zoom app, and a pop-up will appear with a list of the breakout rooms. Click join to the breakout room you wish to join. Next slide, please. So here are all of the breakout rooms. This slide will be displayed in every breakout room, as well as the main room, which is the room we're in right now. If you have any questions, members of the PCG staff will be in each breakout room, as well as the main room, to troubleshoot and help you get to where you need to be. Next slide, please. Oh, sorry, back to the previous slide. Sorry, that was my fault, Courtney. All right, I think we are ready to start the breakout room process.
Great. Thanks so much, Eliza. I'm gonna go ahead and pause the recording. Just a reminder that today's materials, so the slide deck and a Q&A that we're noting down, will be sent to all attendees a few days after the webinar, so do look out for that. And if you are needing a previous slide deck from a previous vendor fair, please just reach out to our TA Marketplace mailbox and we'll be happy to send those over. But do note that materials will be distributed a few days after. So I'll pass it off to Eliza to begin the next section. I
think I'm actually taking it over to Trish. If Trish
Happy to. I was excited. I was like, oh no, it's not me.
Awesome. Thanks, Trish.
Yeah, we'll go to the next slide. So just some changes. If you haven't been to the marketplace in a little while, it's going to look a little different. We've made some updates to the homepage, really to make it a more seamless navigation experience. So you can search by vendor, you can search by project type, you can search by domain, and really just, you know, engage with different organizations and where they are, you know, their readiness to engage with the marketplace. And if we go to the next slide, one of the biggest and most fun new things is we now have vendor profile cards. So rather than having to click into specifically each vendor's page and read through everything, we have these high-level cards that are now available, so you can see what you need to know about a vendor when you're comparing two vendors, and really makes the shopping experience a little bit more user-friendly. And we can go to the next page. So if you were to click on a vendor's off-the-shelf project, we give you an example of what it looks like now. it'll pull up a card that explains the project. So you're not having to click in and out of the website. The card opens right on the page. So you can compare as you're going through and see, okay, here are the components of this one off-the-shelf project. Why don't I click on the next one and see what the components are for that? So this is all under exploring the marketplace. It's open to anyone, not just registered recipients. Even if you are not sure that you want to be a recipient, you can browse the marketplace and look at all of the projects that are available. And if we go to the next slide, a new feature we added early this year is filters. We're very excited about this. So let's say you are a housing provider and you're looking for a vendor that has experience working with housing providers. You can filter based on your provider type. Or if you know you're serving a specific population, such as children and youth, you can find a vendor now that has experience with children and youth. So you can narrow down your search using these filters. And you can also export your list of searches. So if you identify a handful of off-the-shelf projects or vendors that meet your need based on your search, you can export that list and go through that offline as well. And if we go to the next slide. So when you are ready, when you think you are ready to enroll as a recipient, if you've not already enrolled, it is a very quick process. So if you are an eligible organization type, so that's a CBO, city, county, local government agency, an FQHC, a tribal and designee of an Indian health program, providers including hospitals and other provider organizations, or another organization type that's approved by DHCS. All you're going to need to do is download an attestation form. So if you are contracted with an MCP, you're going to use attestation form 1. If you are talking to an MCP but not yet contracted, you're going to use attestation form 2, which is signed by the MCP. And if you are not yet working with an MCP, but you really want to be an ECM or community supports provider, we have an option 3 form that you can submit through the TA Marketplace inbox, and we can get you connected. So once you have that attestation signed, you are going to submit that with your organization's mission, your service offerings, and a little bit of information about yourself. And that is really it. It's a very quick application process. So we can go to the next slide. So we do have some time, I think. Danielle will tell me if I'm wrong, to do some open Q&A if we have any recipients who have questions about becoming a recipient or contacting a vendor. I think we get a lot of questions related to that. Great. Is there a staff training category? Oh yeah, perfect. I'm looking in the chat. We've got some questions already. So is there a staff training category? Yes. So the workforce domain involves lots and lots of staff trainings available as off-the-shelf projects, and our vendors in the workforce domain are able to create on-demand or not on-demand, hands-on services as well. So yes, there's definitely staff training available through the TA Marketplace, and I believe Danielle will keep me honest, we have a vendor fair for that domain coming up in a couple of weeks.
Yes, we do. And I can go ahead and put the link to that registration in the chat, Trish, with the date and time. I did want to notice that some of the questions have been getting pulled into the answer category. Trish, if you're able to take Tatiana Turner's question next about how many vendor services are we allowed to pick? Just 1 or up to 5?
Oh, yeah. So you can pick as many as you like. It's not even up to 5, is as many as your organization needs. We do ask that you limit the requests to the number that you as an organization can actually, the TA you can actually receive at once. So if you have a very limited staff, you probably don't want to sign up for 10 TA projects at the same time, but you can certainly continuously request projects as you move through. And that's what we've seen a lot of, is we've seen recipients who start out with 1 or 2 or 3 projects. And then once they finish those, they realize they need more. And so they come back to the marketplace and they request more. So there is no limit. Just going through the answered questions to see if we missed any. All right. How do you contact a specific vendor? Great question. So on their vendor cards, there is contact information. So you've got two ways of working with a vendor. You can either submit a project eligibility application and start the process if you're sure you want to work with them. But if you want to talk to a vendor before you enter into that process, you can contact them via their email addresses that are on their vendor card. So all of their contact information is available on the TA Marketplace. Oh, great question. Once you're approved as a recipient, how do you start your project eligibility application? So if you are signed in as a recipient, there is the option to shop the marketplace and select a project. So you can select an off-the-shelf project, let's say, and it will direct you, would you like to submit a project eligibility application? And you can just fill it out right there. For an off-the-shelf project, you don't have to select a vendor because a vendor has already created that project and they're associated with it. And you're really just going to say, what's your goal for receiving the TA, why you want to receive the TA. I think it's a couple of other questions that are, very high level. And that is that project eligibility application. It's very brief in hopes that we get that approved quickly so that we don't waste time creating scopes of work and budgets for projects that are not going to be approved. So the project eligibility stage is a very quick process as well. All right, do we have any other questions?
While Trish is looking for additional questions, I will find this a good time to shout out our TA Marketplace inbox, where we do welcome all registered, unregistered, interested entities to go ahead and reach out to us to connect. It is ta-marketplace@ca-path.com. It is in the slide deck. So when we go ahead and send the slide deck around, everyone will have access to that. You can also contact us through a contact us form on the TA Marketplace website. So any inquiries, our team is always happy to help. And everyone you see on this call monitors that inbox. So we're all live people in there answering your inquiries.
Well, I don't see any questions, so I think we can go to the next slide. I got a little ahead of myself earlier. So we do have 2 more vendor fairs coming up. So domains 2 and 7, that's community supports and workforce. So that workforce vendor fair is going to be on April 9th from 9 a.m. to 10:30 a.m. Pacific time. And then domains 5 and 6, which is health equity and supporting cross-sector partnerships, that vendor fair will be on April 25th from 9 a.m. to 10:30 a.m. Pacific time. So you can register on the TA Marketplace website or through the link that is right there on the screen. We are hoping for as good a turnout as we had today, and as great as the questions were today. We're hoping for some great questions on those vendor fairs as well. We can go to the next slide. So we really want to hear your feedback. Both vendors and recipients. So if you don't mind completing this vendor fair survey, you can scan the QR code that's on the screen. But we are going to send the survey to all attendees as well. We really want to know what you thought about the vendor fair and how we can improve these events held by the TA Marketplace going forward. And we can go to the next slide. Or is that the last one? Nope, we have one more. Yeah, and so once again, just highlighting probably the most important piece of information for everyone. It's our TA Marketplace email inbox. That is the best way to get timely feedback or timely answers to your questions from the TA Marketplace team. So that is ta-marketplace@ca-path.com. As Danielle said, we are all live people in that inbox answering questions day in, day out. And we're happy to work with you. No question is too small. No question is too big. We're happy to answer any questions you have. And that is really all we have for this vendor fair today in Domain 1. Thank you so much for joining us. We hope to see you on our future vendor fairs. And more importantly, we hope to see all of the recipients on the call submitting applications and receiving TA. So have a great rest of your day.